In this video, I'm going to be covering the clinical presentations and case management of carpal tunnel syndrome, especially in a client with no direct injury or trauma to the wrist or in through the forearm. For those of you that don't know me, my name is Dr. 𝘞𝘩𝘺 𝘊𝘢𝘳. I am the creator of the 𝑃EEK method and the founder of the Soft Tissue Revolution, where we teach manual therapists a new treatment system that does focus on working smarter, not harder, which will allow them to cut their treatment times by 50% so they can stay healthy and help a heck of a lot more people get out of pain. Carpal tunnel syndrome, I'm using quotes because honestly, anything with syndrome in the diagnosis or the problem list is really just a code word for the provider. The practitioner really doesn't have any idea about what's going on. We get in this problem in the musculoskeletal world of trying to simplify everything and making it very reductionist as we go. A lot of this is done just because of insurance companies and getting reimbursed. So carpal tunnel syndrome just kind of encompasses a whole vast array of problems, like down the arm, into the wrist, into the forearm. And a lot of people just think, honestly, if they have any pain like below the elbow, like if it's in like the elbow or the lateral elbow, they might think like golfer or tennis elbow, but basically the forearm, anywhere into the hand with some numbness, aching, tingling, burning, they go, oh, I got carpal tunnel. I got the carpal tunnel syndrome. But the problem is it doesn't really tell us what's going on. And so many people get these junk box or just BS diagnoses and they don't really know what's going on. I always say, if you don't know what a problem is in the first place, you can't fix it. And I want to show you how I get to the root cause of carpal tunnel like pain. That's what I'm going to say. It's like carpal tunnel like pain. You're not going to hear me say syndrome because that's lazy. That's ineffective. It doesn't tell us what's really going on. The goal is to get to a tissue specific problem list and then know if you have the tools to fix it or if you don't have the tools to fix it, because so many manual therapists end up taking on clients just thinking they can fix everything and then they don't really have an idea what's going on. They're stuck winging it and not having a plan. Sometimes they get it right, sometimes they don't. I want to teach people to have an effective evaluation every single time so you know exactly where to go, how to fix it, and know you're going to get results. So first thing I always start with is a thorough and detailed history every single time. You know, so many manual therapists are like, I don't want to get in there and do a full history or an evaluation. I just want to get on the tissue and see what it tells me. That's why you're not getting results, because you have to figure out what a problem is in the first place. I talk about this all the time in my history. I ask 12 questions. If you're going to be watching this on YouTube, what I'll do is I'll link it up right up top, the webinar for that, the 12 questions that you have to ask every single time before you ever treat a client. In some of those questions, there's some things in the history that I really want to break down for to try to figure out exactly where that carpal tunnel like pain is coming from, if it's actually carpal tunnel, and if we can actually provide the correct treatment to fix it. Number one is going to be, where are the symptoms? You know, a lot of times for carpal tunnel, like I said, people will be like, oh, my whole hand is numb, or I just have carpal tunnel pain, and they're very vague from where they are. I really dial in where it is. And a lot of times with that carpal tunnel, you know, you're going to feel it through here, into that third finger, up to that fourth finger, in through here as well. And then you might get a little bit on the tips of the fingers as well. The next one's going to just be the quality of the symptoms. You know, what do they feel like? And a lot of times with carpal tunnel or the nerve getting entrapped, it's going to be more like a numbness, an aching, and a burning type of thing. So two things I'm really isolating in is like, where do you feel the pain? And then what does it feel like? If it's more like a sharp stabbing type of pain, or it's somewhere else, it's the whole hand, or it's out here, then I'm not thinking that I'm having a carpal tunnel problem. I'm thinking I have to check somewhere else. And then another thing that's really key is, was there any direct accidents or trauma? You know, my big thing when I'm looking at an injury is, was there direct accidents or trauma? Because I'm trying to figure out, like, do I have a local problem or is it coming from somewhere else? You know, so much of the musculoskeletal world is really just trying to go right where it hurts instead of figuring out how it goes. So if there was actual trauma to maybe the forearm down through the wrist into there as well, then I'm like, maybe I do have a local carpal tunnel problem. But most of the time people don't have a direct trauma with there. Another thing that I will look at as well is just like, what do they do for work? Do they have a job where they're doing like repetitive motion? Like, are they like screwing things in all day? Are they work on a factory line? Are they doing something that really allows them to have like more of a repetitive motion on one side than the other? A big problem that I see in the treatment model is just this whole idea of going after the effect instead of getting to the root of the cause. You know, they're like, well, I have numbness and tingling in my hand. It's got to be carpal tunnel. And then you just jump right in there for treatment instead of asking those other types of questions. Like, what did that pain feel like? Was there trauma? Do you do repetitive stuff? What is, where is it? And it's like, you're just getting very basic and very rudimentary. Look at me using a big fancy word, but not getting to the root cause of what's going on. So when I do have a client where I've isolated that the median nerve specifically is isolated and having a problem, I go through this idea of where I'm going to treat. And a lot of times, so I'm not going to treat a carpal tunnel injury presentation if there was a direct trauma, because a lot of times that just needs a surgical intervention, but most people don't have that direct trauma. And I want to just be able to know that when I provide my treatment, it's going to provide the best results and I'm going to get some long-lasting relief. If not, I'm going to refer it out and have them go to somebody else. But most of the time, if they've been having carpal tunnel syndrome-like pain, there's things you can do as a manual therapist. So what else did I write in here? It's important when you work on somebody that you know you're going to be successful and get the results that you need. Quit trying to take on everybody, take on the people you know you can help and have that high success rate. So big thing that I want to see when I'm looking at a client for myself is no direct trauma in there. And then they've seen at least 2 to 3 other providers, maybe a chiropractor, maybe a physical therapist, maybe another massage therapist, maybe they even went to the ortho and they haven't got it kind of figured out. I want to be the person that comes in at the very end, because if I figure it out on the front end, they'll never truly appreciate what I do and my expertise for that. So sometimes people have to go through a lot of bad stuff to get where they need to go to appreciate what you do and how valuable you are as well. So what's most likely going on in here? It's going to be a nerve entrapment. Basically anywhere from, I'd say, up in the C5, C6 nerve roots where the scalenes come out into the neck and then down through the shoulder, into the medial elbow, and then into the wrist. So what are nerve entrapments? Nerve entrapments are a really big deal. So what happens over time, I guess with life, overuse, bad postures, muscles get really beat up and they get overused and they're constantly stretched and contracted. And when this happens, it doesn't get enough blood flow, enough oxygen. So what happens is the body sends a signal to the brain, says, hey, there's a problem here. Body starts going down, lays down all this collagen in there. And when this collagen goes in there, it forms scar tissue, walls off the area. Blood and oxygen can't get in. That scar tissue gets bigger and bigger and bigger. And eventually it expands and gets stuck to the nerve. And nerves are built with about 15% of like extra slack, like a rubber band. And a lot of times when they get stuck, they can cause some big issues in there with that numbness, aching, burning, tension. The other issue that happens is when there is a nerve entrapment going on, the muscles kind of tighten up and what's called a protective tension to unload the area. Because if your nervous system doesn't work, you're pretty much screwed. So a lot of things that present as like tight or weak, a lot of times are just trying to protect that underlying nerve getting entrapped. And that's how I would work my way through it. So when I'm checking for carpal tunnel issues, I'm going to really check higher up in the chain and then work my way down. That's the whole idea. Like I said, a lot of people go after the effect where it hurts instead of the actual cause. I've ruled out that they don't have trauma. They're not doing a lot of repetitive stuff. I'm thinking there's a problem higher up. So now I have to go in and check each area. So where I start first is specifically in those nerve roots on the scalenes, specifically the anterior and middle scalene and that C5, C6 nerve, C5, C6, and C7 nerve root. They kind of control that whole area down through there. And a lot of times that's where the nerve entrapment gets its first start in there. Next area I'm going to check is down on the subscap, right under there. On the front part there, there's a brachial cords, and that's where the median nerve, ulnar nerve, radial nerve, everything forms in there, and it can get stuck right in there through the tunnel, like the coraco-pectoral tunnel. Some people think it can get caught on pec minor. I don't see that as much. I really see it more in the subscap as it goes down. Then it makes its way down, goes into the elbow, and then it's going to get caught in 2 areas down there, specifically pronator teres and then flexor digitorum superficialis. I always get those mixed up. Flexor digitorum superficialis. So it has to make a long way down from where it goes. And a lot of times it's getting kind of kinked or stuck somewhere higher up, and then all the symptoms are coming here. So what's happening is it's stuck higher up in the chain and it's pulling more here. So where that pull is coming, that's where they're getting the symptoms, but it's coming from somewhere else out there. Because remember, they didn't have any direct trauma in there. They didn't have any problems in there. It's coming from higher up. So I'm identifying where those nerves are stuck with that entrapment in that scar tissue. And then treatment is mostly going to be manual in my approach. I do a little bit of instrument work. I can catch a little bit of the median nerve on that pronator teres, but most of it is done with my hands and a manual approach in there. And basically what we do is we isolate where the nerve is stuck, and then it's not bowing. It's kind of stuck there. Then we put it in a shortened position. Then I get proper depth, then tension. Then I have the client go through a full range of motion and hold that back and release that nerve entrapment. Now you're probably saying to yourself, you're like, oh yeah, that just sounds like myofascial release. I already do that. I would say, yeah, on the surface, it appears to be that way. But there are some very big differences in my approach and what I do. Number one is just going to be the precision and the depth are extremely important. You know, most providers are what I call way too compressive, and then they just jam the nerve in there and then they start to move it and it hurts like hell. And the client's like, oh yeah, it hurts like hell. You must be doing something. No, you're just jamming the nerve in there, and it temporarily feels better because you stimulated it, but it isn't actually fixed anything. So it should be a very effective in getting just the right amount of depth and just the right amount of tension. And then understanding when you're doing these treatments, especially on the nerves, you gotta go slow and not be in a rush. You know, people want to do more and more treatment instead of just doing the right treatment. I'll have a treatment where I might spend 3 or 4 minutes just treating that area in the scalenes. And then the next visit, I might be on the brachial cords, and then I might be down there, and only doing that each time. I always say treatment is like a medication. You want to get enough to be effective, but you can definitely overtreat and make that problem a lot worse. So on the surface, it looks like myofascial release, and that's the problem I've seen with myofascial courses, even active release technique, is it's way too compressive, doesn't let that tissue slide, and then you're just pissing the nerve off. You think, and the client thinks, oh, it hurts like hell, it must be doing something, but it's not doing anything, and this is why you're not getting long-lasting results. So a couple take-homes from the video. Number one is take a history. Use your damn brain before ever jumping into the treatment. Number two, don't go symptom chasing or get that reductionist thinking that just because it hurts somewhere, it must be the problem. Lastly, focus on less treatment, but better quality. So that's going to help you in a vast array of problems and getting long-lasting results. If you learn anything from the video, that's why I make them. You know, share any insights or ideas in the comment sections below. You can share this video with anyone else that you think it could help. And lastly, you can go request and download our free training. We dive really into the critical thinking, some assessment, and even showing the proper depth and proper tension, of the treatment process, and help you get on that path to becoming a problem solver. I appreciate you guys watching the video, and we'll see you on the next one. Bye.